My name is Dr. Ange and I'm here today with Dr. David Gilligan to talk about how lung cancer can be treated stage by stage. So let's take it back to basics first of all. What actually is lung cancer?
So lung cancer is where you have got a tumour which appears in one or either of the lungs. And tumours can appear anywhere within the lung that are cancerous.
David, what are the sorts of symptoms that lung cancer can cause?
Well, they can be quite variable. You might have a cough which doesn't get better, coughing up blood, or being more breathless, with pain in the chest area, or more general symptoms like feeling generally unwell and losing weight. Or lung cancer can sometimes be picked up incidentally when you're having a scan or an X-ray for something else.
But the important thing to note is that it can vary from person to person, can't it?
Absolutely.
Thank you. Earlier, we spoke with Jules, who is living with lung cancer.
I was a mum, a full-time worker. I had an Instagram account where I did food blogging. And then I experienced shoulder pain. I got back pain. I had a crackly voice. And then on the 5th of November 2021, I received the diagnosis, stage 4, double lung cancer, EGFR mutation, spread to spine and double pelvis, incurable and inoperable, but treatable. I'm going to be talking about my experiences and my treatment lines of living with stage 4 cancer.
David, how would you test for lung cancer?
Well, here we have a chest X-ray. This is the right lung, this is the left lung, and in the middle you have the heart. And a tumour, for instance, might show up as a shadow and part of one of the lungs, like in this sort of area here.
So it wouldn't necessarily be that shape, but it will show up.
As commonly as what we call a shadow, yeah.
What tests might you do next?
Well, commonly, next test would be a CT scan. And here is an example of a CT scan. Now, that can be quite difficult to get your head around, so let me guide you. So what we're looking at here is, it's like someone has come and cut you across this way.
Right.
And you're looking at you from below. So this is your right lung, and this is your left lung. And in the middle are the structures near the heart, and this is the main breathing tubes on the left and on the right.
Okay.
So if we go back to what I showed you on the chest X-ray, you might have a tumour, for instance, in this sort of area here.
And you also mentioned something called a PET scan. What does that look like?
Well, a PET scan is actually a combination of a CT scan and a PET scan. And here we've got an image of a PET scan, and this is taken a different way. It's like you're taking it down through...
So it's a vertical slice.
A vertical slice, absolutely. And the difference with a PET scan is it gives us a little bit more information. So when you have a PET scan, you have an injection of a very small amount of radioactive glucose, sugar.
Okay.
And this goes to areas that are cells that are turning over really quickly. And that can include cancer cells. So on this PET scan, you can see the lungs again, the right lung, the left lung, but this time in the left lung, you can see that there's this area glowing, which is actually a tumour.
And if you look at the scan, you'll see that other areas are glowing as well, but that doesn't necessarily mean there's a tumour there.
No, because that's the glucose going to other parts. But we know what's normal and what's abnormal, and that's how we can diagnose where the cancer has gone to.
Right, so if we're talking about early stage lung cancer, what is it and what might it look like?
Okay, so an early stage tumour is a tumour which has started in the lung but actually hasn't spread anywhere. So again, going back to the chest X-ray, you can see here we've highlighted an area where a tumour could appear, and you might have a tumour that is just in that one part of the lung and hasn't gone anywhere else, hasn't spread to any other parts of the body or any other parts of the chest.
So how would you potentially treat that?
Well, the most standard way would be surgery, an operation to remove it.
What happens during surgery?
Well, typically what we are trying to do is remove the tumour and a piece of normal lung around it. And it would mean taking out a piece of lung like that. The right lung is in 3 different bits. There's the upper lobe, the middle lobe, and the lower lobe. And on the left, you've got an upper and a lower. But in this particular case, this would be a right upper lobe tumor removed, a right upper lobectomy. And commonly, most lung cancer surgery is now done by keyhole. However, there are other treatments that are available. We know that people who are not well enough or fit enough to have an operation or don't want to have an operation, radiotherapy might be an alternative. And also, we're increasingly using other treatments in addition to surgery to improve the results of surgery. And one such example is combining chemotherapy and immunotherapy before an operation.
So that puts you in a better position for when you have your surgery.
Yeah, it's been shown that for certain types of tumours, it may shrink down the tumour and make the results of the treatment better.
Okay, moving on to the next stage, what do we mean by locally advanced cancer?
So if we come back to the chest X-ray diagram here, we can see the tumour, but if it's a locally advanced tumour, it might have spread to lymph nodes, which are sort of typically in these sort of areas.
How would you treat locally advanced cancer?
That can typically be treated with a combination of chemotherapy and radiotherapy, often given together at the same time.
Show me how they work.
These are normal cells. They might be blood cells, they might be hair cells, they might be any cells that are normal in the body. And then these are cancer cells, which tend to be more bizarre looking. They can be quite big, they can be of various sizes. But chemotherapy will basically go into the cell and damage the DNA in the cell and kill it, and hopefully kill all of the cancer cells.
Chemotherapy is usually pretty good at killing off cancer cells, but the reason you get side effects is because it's also really good at sometimes attacking normal cells that are rapidly dividing.
That's right. So you will get some collateral damage to the normal cells, and that would give you side effects.
How do chemotherapy and radiotherapy differ?
Well, chemotherapy is a treatment that goes around the whole body and affects all parts of the body, whereas radiotherapy is focused just on the one part of the body where the tumour actually is. So if we look at the cancer cells again, you will find that there are some normal cells in the vicinity of the cancer cells, but the radiation won't affect any part of the body that it isn't aimed at. So if we look at this as a tumour, it will kill the cancer cells, but it also may damage the normal cells in the vicinity of the tumour, but leave the other cells unaffected.
So what kind of side effects might this cause?
Well, side effects from radiotherapy usually only affect the part of the body that the radiation is aimed at. So, for instance, one common side effect of radiotherapy for lung cancer is some discomfort when you swallow, because the cells in the lining of the gullet can get inflamed and you get some discomfort when you swallow. But usually, away from the area that the radiotherapy is directed, there aren't any side effects.
Now let's talk about advanced stage lung cancer. What is it and how does treatment differ?
Advanced stage lung cancer means that the cancer has spread to other parts of the body, and that can be any part of the body, but with lung cancer that can typically be in the liver or the bones or the brain.
And how does that treatment differ?
Well, that can include treatments like chemotherapy and radiotherapy that we've already talked about. However, there are other treatments such as targeted therapies and immune therapy which have really revolutionized the treatment of lung cancer in the last few years.
Take me through each of those.
So, targeted therapy is suitable when you have a particular molecular abnormality. And if we go back to when we did the biopsy, we can do special tests on the biopsy to see if a particular tumour has a particular molecular abnormality. And I'll demonstrate this by looking at the cancer cell again, and you can see that there is a particular abnormality that is on the cancer cells, but not on the normal cells. And then you have a drug which will come in and basically go through, find the target, and then take out the cancer cells, leaving the normal cells undamaged.
So how does immunotherapy work?
Immunotherapy is a relatively new therapy and works in a really exciting and clever way. There are immune cells in every part of the body, and if I show you with this blue cell as an immune cell, And what cancer cells can do is that they can hide themselves away from the immune system so that the immune cell can't see the cancer as a bad cell and attack it. And immunotherapy is a drug which comes along and allows the cancer cell to be seen by the immune cell so that the immune cell can come along and attack and kill the cancer.
What sorts of side effects might someone experience from things like targeted immunotherapy?
So targeted therapies are, generally speaking, much less toxic because they are targeted to just the cancer cells and they don't affect the normal cells. But there are some side effects which can include things like tiredness or sometimes a rash or sometimes diarrhea, but usually much less than with chemotherapy. Side effects of immunotherapy are different again. Because you are changing the way the immune system works in the body, as well as the immune cells attacking and killing the cancer cells, sometimes, not always, they can have effects on the normal cells of the body and attack those too. And that normally shows up itself as an inflammation, so you might get some inflammatory side effects, which can usually be treated very quickly and effectively.
And we spoke to Jules about her experience of treatment after she was diagnosed.
So I was diagnosed 5th, and then 18 was when I took my very first tablet, which is targeted therapy, which is osimertinib, which is a drug that was only approved in 2015, so very new. So it's a tablet once a day, and that tablet will suppress my cancer. So I like to say it pops it to sleep so that I can carry on living as normal. Never did I think that I'd go to my first appointment after 3 months of the drug in my system to be told that there was a 90% reduction and that every part of my body that was diseased was stable. I mean, it was just music to my ears. I'm scanned every 3 months on my treatment line. And obviously, as I'm now 2.5 years into my journey, to have that continuous pattern of stable, it's just, there's nothing more magical about it. It is amazing.
Thank you so much, Jules, for sharing your experience with us, and thank you, David, for those incredible explanations. Remember, symptoms of lung cancer include a cough that doesn't go away or has changed, breathlessness, or coughing up blood. You should always get any symptoms that are ongoing, unexplained, or unusual for you checked by your GP. For more information or support, call 0808 808 0000 or visit macmillan.org.uk. Now, before you go, if you found our conversation on lung cancer insightful or useful, please don't forget to hit the subscribe button. And you can also like this video and share your thoughts or questions in the comments below. Thank you so much for watching.